gonna go to the second speaker. I have the pleasure of welcoming Dr. Jean Hébélamou, who will present to us today clinical cases and his presentation facilitating computer-assisted reading of chest X-rays for tuberculosis screening of the Macenta Regional Hospital Center, Republic of Guinea, presentation of clinical cases. Dr. Hébélamou, I would like to know more. Here's for you.
Docteur Hébélamou, ok, c'est parfait, merci.
Okay.
Hello everyone. Thank you for allowing me to speak. I'm Dr. Jean Hébélamou. I am the Deputy Director General at the Hospital Center, Specialized Center of Macenta. I have the honor and the pleasure of presenting to you the theme. Next slide. That is facilitating computer-assisted reading of chest X-ray for tuberculosis screening at the Macenta Regional Hospital Center, Republic of Guinea, presentation of clinical cases. Next slide. For this presentation, we're going to follow the plan. First part, we're going to have a small introduction. Then we're going to look at our main objectives, our observations that were made, and then a conclusion. Next slide. So indeed, the Regional Hospital Center of Macenta is a center specializing in the treatment of leprosy, tuberculosis, and HIV. X-ray, the conventional radiology that we use today was installed in 1898 and worked until 2023, year in which automated interpretation of digital radiography was introduced by the Missions Phil-Africaine, which is our main partner. Next slide. We should say that tuberculosis is an infectious, contagious disease of bacterial origin that affects the lung, mainly, and it is caused by two types of bacteria spreading through the air, transmitted therefore by infected people through coughing, sneezing. Tuberculosis is therefore a preventable disease that is curable through a well-led treatment. Next slide. There's about 1/4 of the world's population that is infected with tuberculosis, and in Guinea, the incidence rate is of 100 to 199 cases per 100,000 inhabitants per year. And therefore, as a definition, TB is a contagious disease caused by Mycobacterium tuberculosis. Next slide. The main objective of that presentation is to report cases of tuberculosis diagnosed by Dutch digital radiography with CAT for TB at the Regional Specialized Hospital Center in Macenta. Next slide. The first clinical case was about a woman of 36 years old who was a merchant from Sugiri, that's located north of the country, in 454 countries north of Macenta. She was admitted April 14, 2025, and her complaints were cough, fever, dyspnea, and vomiting. The progression was approximately 3 months. She had no particular medical history, no defects, no history of tuberculosis infection. Next slide. When she was admitted, she was conscious, cooperative, and had an active attitude. Height 174 centimeters, weight 52 kilos, and a BMI of 17.2. Lungs showed crackling rails in both lungs. Other systems had no problems to note. Next slide. This patient showed an chest X-ray with infiltration scattered in both fields in the right lung, as we can see it. And the score showed us an 84.750 score, therefore a possible TB. Next slide. In parallel, we also asked a gen expert, and it revealed positive, of course. Also, when this patient, when we offered a screening, she was already on a retroviral treatment. And therefore, with that co-infection of HIV, we added the DTG. So the anti-tuberculosis treatment was instituted. 2 months of 2-RHZE and 4 months of RH that were offered for that patient. Next slide. The second case was about a 41-year-old man who was a farmer from Guayama, who's located 140 kilometers from Macenta. This patient was admitted May 31st, 2025 with complaints of cough, fever, dyspnea, physical asthenia. The evolution of it was approximately 4 months. He had no particular medical history, no defects, on no history of tuberculosis infection. Next slide. When that patient was admitted, he was conscious, cooperative, and had an active attitude. Height 171 centimeters, weight 52, BMI 17.8. Lungs showed a crackling rails in both lungs, and other systems had no problem. Next slide. X-ray was also realized for this patient. As we can see, of course, on this image, we had infiltrations scattered in both lungs, and the score showed us a value of 84.97, therefore a possible TB. Next slide. The gen expert was also required. It revealed itself to be positive, detected T, and HIV status was negative. The anti-tuberculosis treatment was also presented at the same cycle. 2 months of RHZE and 4 months of RH. Next slide. The last clinical case was a man of 73 years old who was a farmer from Kirwane, who's located 127 kilometers from Macenta. He was admitted April 10, 2025 in our center with complaints of cough, fever, dyspnea, hiccups, and dysphonia. His progression was approximately 1 month. He had no particular medical history, no defects, or no history of tuberculosis infection. Next slide. This patient, when admitted, was conscious, cooperative, and feverish. Height 163 centimeters, weight 47 kilos, BMI of 17.65. The lungs showed no rails, and the other systems had no problem. Next slide. X-ray was conducted for this patient, which showed the images that you can see here of infiltrations in both lungs. The score showed us a 94.810, therefore a possible TB. Next slide. Here, the gen expert that was required was not detected, so therefore negative. The HIV status was also negative. And therefore, the diagnosis of tuberculosis miliary TB was therefore retained. And therefore, we tried an anti-tuberculosis treatment with the same treatment of 2 months RHZE and 4 months RH. Same pattern as the different patients back then. Same, next slide. We should say also that this last patient, 2 weeks after putting that treatment in place, the fever had lowered, and also the other symptoms. And therefore, we said, on admission, if there was no good evolution, we should consider the following differential diagnosis with other diseases such as autoimmune fibrosis, sarcoidosis, and silicosis, especially because the patient was coming from a mining area. Next slide. As a conclusion, we should say that tuberculosis is a public health problem in sub-Saharan Africa. The performance of automated reading helps to better interpret images and to diagnose tuberculosis quickly. Its use could increase the detection of tuberculosis at the Macenta CHRS. Next slide. However, this new diagnosis method presents challenges because all TB cases are still being reported, even if the patient took its treatment correctly, because the system is still going to show it as being a new case, and it's not specific, therefore, to active tuberculosis. This does not also rule out other diseases with a similar differential diagnosis to TB, with which therefore we have to do a differential diagnosis. So it's important, therefore, to introduce those diseases in the CAD framework. We want to thank you, therefore, for your kind attention. Next slide. Thank you for your kind attention.